And thank you so much for putting in the notes right in here in terms of your pressing issues. So next slide. Just before we dive in, just wanted to give a little bit of context about who we are, the Population Health Innovation Lab, or better known as PHIL, is what we go by. Our mission is to create opportunities to experiment, share learning, and lead lasting change. And we work a lot with collaborative partnerships. And we really exist because we know that community change work is really hard and it's often isolating and it's very complex. And we really are very focused, right, on providing tools and opportunities for people to come together. So we really like to equip communities and change makers to help navigate challenges, catalyze equity-centered solutions, and strengthen systems that support lasting well-being. So today is our community health solutions. It's one of our offerings that we do, and the intention really is to provide opportunities to share stories, right, and solutions that are coming from problems that people are seeing or experiencing in their communities. I think it's really important to share those stories. There's lots of ways to solve issues. Logic models might be one of them, but I think going on a journey and really experiencing and iterating is really important. And so today, really, I'm excited because we're going to hear about a nicotine addiction solution. So next slide. And so with this, I'm going to be turning it over to my colleagues. I'm very grateful to be with you all today. So Meg Buzzy is amazing and a systems change specialist and coach. And we are joined with two Kiwis, if it's okay to say that, from New Zealand, Luke McLeod and Ryan Winckel, yes, who are going to be sharing kind of their story and their journey and their product that they are developing. And so with that, I am going to turn it over to Meg.
Yeah, thank you, Sue. Thanks everyone for being on the call today. I'm Meg. I work in innovation a lot, and I do a lot of systems change work, both here in the US and in New Zealand, which is how I got to meet Luke and Ryan and hear a little bit about the challenge that they're solving for. And so today we're going to have kind of a casual interview where we invite your questions and your commentary. And so definitely feel free to engage with the chat, and then we will have time at the end of our interview today for your specific questions and more of a conversation. So want to invite you all into that. And just to add, this interview series is part of a magical collaboration between Sue and her wonderful team and myself as we try to combine forces to say, what are these innovative solutions? Where are pockets of solutions that already exist that we can apply to other places, other markets, and let everyone know about the good things that are already happening, because we all know there's a lot of challenging things happening too. So we're the anti-voice to that. So welcome everyone. And I just want to, I guess I'll pass it off to Ryan just to give us a little bit of an introduction to what we'll be talking about today, which is a cessation product called Lesser Evil. So Ryan, over to you.
Thanks, Meg. Good morning or afternoon, everybody. Firstly, thank you to Meg, Sue, and the team for putting this together and getting us here speaking all the way from New Zealand. And thanks to everyone for turning up out of their busy days. I'm Ryan. I've got my co-founder Luke below in the audience, obviously both based in New Zealand, and together we've started the company Lesser Evil. We're an alternative nicotine cessation and harm reduction company. Luke and I, we're not doctors, scientists, but today we're here as two people like millions of others who struggled to quit vaping or smoking, even the pouches and whatnot, and decide to take those matters into our own hands and create our own solution. We founded Lesser Evil based on the simple observation that for many, the biggest barrier to quitting isn't the desire, but the approach. think the current cessation aids feel very clinical, possibly intimidating, almost like a medicine. And this white coat problem creates a huge psychological hurdle, forcing people to formally admit they need help before they can even start their journey. So philosophy is quite different there. We've positioned lesser evil as an accessible consumer good, but designed to be in the place where people currently purchase their nicotine from, rather than going and talking to their doctor, or thinking about cessation actively. And it's supposed to be that self-empowering choice. The product itself, and this is our first product of ideally a few, is a very low dose oral nicotine spray that gives users something they've probably never had with a vape or a cigarette, which is the total control of how much nicotine you're having. It delivers much less nicotine per dose, and we make everything with natural ingredients. Just be a lot more transparent about what's in the bottle and what people are having in their body, along with sort of cessation plans that go along with that. It is a much slower absorption compared to other types of nicotine administration. And that's really critical, we've found in our research. Break that intense addiction loop by decoupling the physical hand to mouth, but also the immediate chemical reward that comes with something like vaping is even quicker than smoking, for example. And we've really found that to be sort of a key in reducing consumption. We made our first product ourselves about 15 months ago, and both Luke and I personally have never touched a vape since, which is a massive success. But we actually have hundreds of these stories now. For a few times there, we thought about giving up, but just hearing from the communities that it's touched and people that it's truly helped, that we're quite passionate about pushing this forward. We know it works now, which is a great place to be. And the challenge we have is scale and navigation of bureaucratic landscapes, you could say. We're here today to sort of accelerate our US rollout, actively looking for partners, collaborators, people in those industries or communities that have the same approach we have, or the same desires, and can help us through. Yeah.
Ryan, thank you. I want to hit on something you said. You said you're starting to collect hundreds of stories of people impacted by this new sort of new way of looking at cessation, and like this sort of new program. But I'm curious if this is a question maybe for both of you. I would love to hear one of the stories, if it's one of your stories or one of your customers' stories.
I can take this one, Ryan.
Go for it.
Yesterday, one of my friends messaged me and he said, thought you'd like to know, since you gave me those misters, which is what the product is called, for the lesser evil product, I haven't vaped since. Honestly, I think it's the perfect product. And I said, wow, I'm so happy for you, man. How are you feeling? And he said, so good. Lungs are healing as we speak. Yeah, and it's just that was just yesterday from like a friend of mine who's been vaping for, oh man, like as long as I've known him. And then, he asked if he could have some of our product, and I gave him some, and now he hasn't vaped since for the last like few months, which is pretty sweet.
And
Nice. Oh, please go ahead, Ryan.
I was just gonna tell a few more stories, but from people like cigarettes mainly, and it's actually some young friends of ours, or colleagues, I guess you could say now. But yeah, we're smoking a lot of cigarettes as well, and they took this over. They started using the mouth spray, which again is quite a conventional cessation product. But I sort of put it there in that white coat syndrome where they didn't go for, say, a Nicorette or something. They've been using that for a few months and pretty much just weaned themselves off nicotine entirely via that. And we've got a bit of a database of these stories and timeframes and much people are using and whatnot.
Yeah,
Share
I
at
guess
some stage.
how I like, I mean, when I first started using the product, it was like a little glass vial that we were mixing ourselves. You know, it was like water and a bit of nicotine and some flavoring. Um, and um, I like I didn't realize like what my relationship to nicotine was um until I really sat down and I guess like thought about like why was I vaping so much? Why did I need to vape? And like what was it giving me that I really liked? And it was it was only when I started actually contemplating that I thought, okay, well, if I actually like nicotine and how it makes me feel, why am I using a product like cigarettes or vapes to get my nicotine? If I can get it in a way that's much safer, delivered orally, like through a spray, then I can reduce the harm of the nicotine, um, and but still continue to get nicotine. Because I suppose I tried several times over the years to quit, but um, when you work in an office and you're going to meetings and all these kinds of things, I know it sounds a bit pathetic, but like it's hard to quit when you're stressed because you use it as a coping mechanism, right? And um, you know, when I finally decided that I didn't want to do it anymore was because I was having a little sneaky smoke right before my before a meeting. I'd sneak off to the bathroom and I'd do a little bit of vape in the bathroom. It was like it was so embarrassing, and um, and I was like, man, what's going on with me? Like, why am I doing this? And yeah, I had to really like sit down and go, what am I trying to get out of this, and why am I using this product? And then once I had, um, you know, I guess made like broken the connection of like I don't need to inhale something in order to get nicotine. If I can get a smaller dose and delivered orally with ingredients that are like not toxic to ingest or to eat, then that would be the ideal product for me. And then that's when I started looking for something that could do that, and then couldn't really find anything. And so I was like, what if I just make this? You know.
I love it because it's also just speaking as someone who's only gotten a chance to interact with the innovation the innovation ecosystem of New Zealand, but it is such a part of your culture also to be like, well, no one's coming to save us because we're on this island, so we better figure out a solution
Yeah.
with whatever I have at hand.
Yeah.
Yeah.
So I definitely hear that sort of ingenuity in your story, and also vulnerability to like really be curious about like, well, what is my relationship to this? Why is this
Mm,
so important? Why am I using it this way? And I'm
yeah.
wondering if you might also just say a little bit about what vaping is like in New Zealand, because here in the US we might not um, fully appreciate
Mm,
the scale of it in New Zealand as opposed to here.
huge. So I think it's 25% of the population vapes in New Zealand, which which is massive. I think in the US it's like 11 million adults use vaping devices. And then in New Zealand, if it's 25% of the population, it's almost a million, maybe 1.5 million people in New Zealand will vape. There's vape stores everywhere. So like we've got convenience stores, and in every convenience store, there is a separate vape store attached to it. And I think, well, there's a lot of reasons why. Obviously, it's an addictive substance. When it's delivered through a vape, it's extremely addictive because of how quickly it's absorbed into the bloodstream. But also in New Zealand, it was supposed to be the product that was going to get people off of cigarettes, which was also a huge problem here. And largely that's been successful. Like or not, the smoking rates have reduced to below 5% in New Zealand, which is pretty good. But now
Yeah,
it's
just the,
like, yeah, sorry, go Ryan.
no, it's going to say the other part of it in New Zealand is we have a big issue with at-risk populations. So in Pacific Island, people have a much higher incidence of vaping, and then I guess especially smoking and vaping
Mm.
related issues as well. And we also have an extreme problem with youth vaping. So they did bring in vapes for those replace smoking and be that savior, but they've found it's about 10% of people in 14 to 15 years old in the classroom smoke and vape regularly, which is extremely concerning, that sort of behavior as well, and what the trends are showing there as well. It's increasing year on year. Definitely
Mm.
a problem here for sure. It's something that needs to be addressed. There was some stuff coming through legislation in New Zealand that was supposed to address a lot of this, but it is quite slow and reactive. And so I think having a bit more of a grassroots push, a bit more proactive is what we're trying to do our part as well. Just either A, provide that safer alternative to people who can have the exact control and knowledge of what they're doing, or genuine cessation path that doesn't involve sort of talking to your doctor. You're more self-empowered to. Yeah.
Yeah, thank you for that context. I think it's really crucial. So the urgency and the intensity of the challenge in your context, like drove you both to tinker in your kitchens or wherever you tinker
Really,
to
really.
to find this. Um, what are some of the most innovative things about it? I mean, both of you touched on some of them, but we know it's a spray. Tell us more about like what makes it different than other things that we might know that are behind lock and key, in
Mm.
a Target aisle.
Mm. Um, well, I think so. What the biggest thing for us was to make a safer alternative way more accessible, right? And so that was like the the driver behind everything we're doing. So the product that we've produced is low cost. If it was to be on the shelves in America, it would be like 10 to 12 US dollars. Um, and that would last you, depending on how much you're using, um, 2 to 4 weeks, which is a really long time compared to sort of like vapes and cigarettes. Um, the other portion of it is the dosage that is delivered is lower than all other cessation products or oral nicotine products, or even I guess it's hard to compare the dosage to cigarettes and vapes, but you absorb it slower, and it's a lower dose. So each of our sprays is about 0.75 milligrams of nicotine, um, which is much lower than like I think the chewing gum is normally 2 milligrams per per gum, and then the pouches only go as low as 3 milligrams, and then the uh, like a cigarette is normally 12 milligrams of nicotine, but you'll absorb maybe like 1 to 2 milligrams of nicotine, depending on how deeply you breathe it in. And that's the same for vapes. But the strength of vapes can go really high because of the salt that they use. It makes it less harsh, and so that they can jack the strength up of the vaping liquid. And so you end up um, breathing it more because it's fine. Like there's no consequences. There's no like immediate consequences. Um, yeah. So when it's a low dose, that means that you can when the default dose is low, you can really have a lot of control over how much you're doing, and you can choose when you want to do it. Um, there's some there's another piece of innovation, but I'll hand over to Ryan if do you want to take that one or add to anything that I've said?
Yeah, I just see a few comments starting as well. So could address some of those, but I think you've hit it on the head there, Luke. I just wanted to add to that we have heavily debated internally going down the medicinal route in New Zealand. That makes it a lot easier to get it in people's hands through traditional routes, but I think those traditional routes lead people in. So there's a lot back to that sort of white coat syndrome, I think, and people come to terms with addiction. Often talking to your doctor or going down that route is really admitting a problem, and a lot of people with nicotine don't want to do that, we've found. And so our big push is to have this, again, self-empowered, it's ideally more as a consumer good. We don't want to call it cool, but we want it to be discreet and sleek. But it's not a medical device, or even like the Nicorette has a spray, but we found that to be quite clunky and medicinal as well, and quite off-putting for a lot of people. Like, the doctor said to try this. Hey, I'm at a vape store at a smoke shop. See this spray here that's supposed to reduce harm, or people have successfully quit. Maybe I'll try that today instead. That's the decisions we want to people.
Yeah, we have a couple questions in the chat, one of which is related to this, but the first is just discussing more, if you could discuss a little more about the development of the product and any future plans for getting more people to use it, or like what's the marketing rollout?
Yeah, perfect. Do you want to go for it, Ryan?
Thinking maybe we could, speaking of a bit of marketing and brand, maybe we could share those slides.
Or future plans for testing was another part of the question. Yeah.
But yeah, so around the development, to be fair, it was very grassroots, Kiwi-esque, as we'd say. We did start in our kitchen putting nicotine and water together in a NutriBullet. We have moved on to sterile labs of that journey. A lot of it was around that drink aspect. You need enough people to notice, not too much that it is, the rush or it, you could say, right? So we found that sort of what we think is a sweet spot, quite a low dose. People who are really heavy smokers, we found, can have a couple, 3 sprays. If they really need to get a bit more, that's still quite low dose, which I'm not sure if there's any sort of specific product development questions, around even engineering logistics or spray heads and all that sort of stuff that we have been through. Can tell you all about atomizer liquid. In maybe speaking to the future plans and the marketing and getting more people to use the product. I think it's education is the big thing for us. And having these conversations is going to be big for us. The landscape, the regulatory landscape in New Zealand is quite difficult with what that we will be classed as tobacco, even though we don't use tobacco. You unfortunately have to go under those rules. And if we wanted to, New Zealand and the US are the only countries that you can actually advertise in medicine. So if we went down the medicine route, we could then advertise here, but that's not really a tricky path to navigate, right? Do you want to advertise this, or do you want to people to find it naturally? And ideally, we just want to make sure that people know the effective cessation tool, and it's readily available at the places they shop. We have done a lot of work. Oh, you go, Luke. Sorry.
I can see one here around future plans for clinical and efficacy testing. So I'm sure everyone on the call knows that the clinical trials are, I'll use some Kiwi slang here, bloody expensive. So we were working with a pharmacist, a guy in New Zealand who worked at Douglas Pharmaceuticals, a local New Zealand drug manufacturer, and we were working with them to see if we can how we can get the product lined up and ready to start going through the new the drug application process in New Zealand, right? So we could get it registered as a medicine here, so that we could then advertise in New Zealand. And then potentially we could leverage that to get it registered as a medicine in other countries. But the cost for us would be at least $1.5 million New Zealand. And like we don't have that kind of money lying around to get that kind of stuff started. Um, and and then it's a similar story in the US, right? It's like there are two pathways to market in the US. We could get registered as a medicine as well, which is going to be sort of millions of dollars again in the US, and then to register under the PMTA, which is the tobacco route. That's also a I think we got quoted £4 million to do that whole process, and it would take 18 months. So there's some things that we can do to sort of begin that process and start that without upfront paying for that whole thing. But it's a really expensive process. It takes a long time, and it feels like we're just paying for like lobbyists or something to like go in and like be like, you know, like I just yeah, and so I think for us, like we've been we, I think that around the efficacy of the product is mostly we've given it to our friends and our friends have given it to their friends and they've been testing our product samples, which sort of look a bit like this. This is our old product sample brand here. Um, and so it's been manufactured in a lab and then bottled and that sort of thing. And we've sent those out, and they've been really successful in getting people to reduce the amount of nicotine that they're using, get off of smokes and vapes. So that's sort of been our version of of efficacy. Um, yeah, and so the plan for like rolling it out really is to try and get it in market as quickly as possible. In New Zealand, we've got a route to market at the moment. It could be blocked by the government if they wanted to. Like they could just say, nah. They could go, nah, you're not what you say you are. You're something else, and then they could block it. But right now we can do that. So we're gonna try that, and we're gonna go for that. And the same in the US. Like there is a way to sort of like start the PMTA process for a reduced sort of price. And actually I think there's only like 50 products have been approved by the FDA through that PMTA process. I've got the list somewhere on my computer. And that's across like 6 companies. And there are literally thousands of tobacco products on the market, and there's only 50 that have been approved. So everybody's sort of like skirting the rules somehow. So our plan um, is to yeah, basically we I think we believe in our product, and we know that it's a better alternative. And so we want to try and just do what we can to get it to market quickly, um, and get it into stores, because most people are buying their tobacco products or their nicotine from shops. So that's the best place to do it. I think Ryan touched on it. It's like when they go in to buy their cigarettes or their vape, if there's something there that they go, okay, oh, that's different. It's a healthier alternative. You don't have to breathe it in, save your lungs, that kind of stuff. That's where we want to catch people.
Hi, Meg and Luke and Ryan. There was a question from Lynette.
Just saw
And-
that.
Yeah, okay, just.
Do you want to ask it, Sue? Go for it.
Sure, let me get it. Does the
Okay.
product come in increasingly lower nicotine doses? Is cessation the ultimate goal?
So
Kind of like.
we designed it with quite a low dose per spray as it stands, which kind of gives the user, the power. You can have spray for quite a low dose, and it depends. Yeah, obviously there are nicotine users out there, but that means they can have a few sprays at that stage. It's quite quick math. You can have, exactly how much you are using. So we've got a single dosage at the moment. We've toyed with the idea of a slightly higher one, and we're still open to feedback around that. We've found that this this dose as it stands is working quite well for people. For some extreme cases, right?
And you
He's
said
talking
that's half a milligram?
0.75 milligrams per spray we're doing at the moment.
Yeah.
And is cessation the ultimate goal? We have a couple goals here. Really, it's a cessation. Ultimately, that's going to be the safest way to use nicotine is to not use it. There's a lot of things coming out now about the nootropic benefits and whatnot. We're seeing the biohackers, that sort of stuff. So we are seeing people to continue to use nicotine regardless of what we say, right? It's so the second part of that is minimizing the harm. If you're going to use nicotine, which a lot
Mhm.
of people are not going to stop, let's be real. It's not no one's some of their desire, they don't want to stop. At least minimize the harm. You shouldn't be clogging up your harm, getting popcorn lung, or increasing your lung cancer, or the like. So we have found this is a much safer route. That's probably the goal there with a dose of reality, I think, from ours. Cessation is the goal.
I
Not we
think
can't.
I think as well with we're small and we've got limited funding, and so like complexity adds quite a lot of cost to what we're doing. So we've got the one dose for now because it makes everything so much easier, right? Like we don't have to we can have the same instructions, the same warnings, the same everything across our products. Um, which is just the one product because it's just the one dose right now. So that means that when we're working with our suppliers, it's easier. When we get our like the packaging, it's easier. When we print the instructions, it's easier. In the like the longer term horizon, we have on our product roadmap um, different flavors because not everybody wants to have a minty flavor in their mouth because that's our current flavor. Um, and then we've also got a lower and a higher dose one because some people want a higher dose, some people want a lower dose, some people want the one in the middle. I guess we'll probably just make them and see what people actually use, and that'll dictate what gets made. But then the our fight what on the at the end of our product roadmap we have a mouth spray that has no nicotine in it, which is uses other sort of nootropic type ingredients like L-theanine, lines like micronized lion's mane is some and like some B12s and B vitamins, because like essentially what people want from nicotine. Well, this is my opinion, but what nicotine does for me is it turns my brain on, and I go, it's like a mild, it's a pretty good stimulant. It's like it's like a better coffee, really, to be honest, and that's what people want it for. That's why it took off in the early days. People would work in on their typewriters, and then they would like have a cigarette, and like their brain would turn on. That's what everybody was after, right? And people were trying to get stuff done, and I think that continues today. And so I think if we can mimic those effects, those uh, with something that isn't nicotine, potentially we could have a product line that drops the nicotine all the way down till you get to something that's got nothing in it but has like caffeine, L-theanine, B12s, some concoction of vitamins. And I was talking to a lady about fatty acids. She was like, fatty acids are like the new thing. She's like, yeah. And so potentially something there. So it's in the pipe. Like we want to do all this stuff, but we really can't do anything until we have money to test these things and try them out, really. And we know that what we've got right now works as a massive harm reduction from smoking and vaping.
Thank you, Luke. We have another kind of juicy question. I think this one might be for you, Luke, but
Yeah.
working in the cessation arena, um, Denise is asking, often individuals who fail at quitting it's the underdosing compared to the high nicotine usage of them. So just wondering, I think she's asking about how does your misting product accommodate the high dose user by in terms of minimizing withdrawal or ultimately quitting.
Yeah,
I could
I think Ryan
also
actually
talk
touched
to
on
that. Yeah, and maybe to touch again is yeah, some of those edge cases are difficult to solve. Yeah, we've got someone we know of that has the pouches, and he has 150 milligram one once, which is if Luke and I tried a 12 once, and that just about sort of knocked us off posts, and so that is quite an extreme case that's out there. There's a few sort of methods to it as well. Often we probably, for those high dose, and in our experience, we haven't advised people to just say go cold turkey straight to this, right? That's in reality, it's not going to work for them. It's more filling in those blanks, right? They have what they normally have. Say they smoke 20 cigarettes a day. Let's try 15, and in between those times, spray here and there, just really get that irritation away, or the sense of withdrawal, essentially. But that's sort of what we've found in our experience thus far. Those high dose people, the 150 milligram person is a little bit of a special case. That's it's hard to have a single product to solve it all. Essentially, there we also are trying to decouple the habit from the reward a little bit, and part of the oral intake is that delayed onset of the nicotine. So you're not getting that instant reward like a vape. And so trying to decouple that behavior as well is massive. As well as
Yeah,
some people sort
that's
of
a good that's a good thing to point out. Oh, sorry to interrupt. I was just
no, you
thinking
go.
about what you both said earlier about your product doesn't allow the rush. And because you don't get a rush from it, because it's so low dose, you don't build that same emotional reaction. Or like you said, you're decoupling some of that rush. That's that dopamine.
Yeah, literally, right? I think some of the research we've seen about the time that a vape sort of you feel it through the lungs is it's so fast. Your brain naturally forms. It's such a direct correlation and link of putting this to your mouth and the reward from it. And so at first it's quite off-putting, having something you sort of spray it and you think, oh, it's not doing anything. Then, a minute later you just sort of start feeling a bit more like, and you're like, oh, okay. But you don't get that immediate hit, right? And that's because that is dangerous. And that is really habit forming. Um, and I think another thing I was going to touch on is that sort of the fixation of, an act or like holding something to your mouth. And so we are trying to replace that in a way as well with the spray. And with that, there are those sort of vapes out there with no nicotine. There are the vapes, the pens that you're just breathing air through as well. And the same thing goes with the mouth products as well. You can sort of in between and sort of part of a plan. But hopefully that sort of touches, Denise, on your question. But these are great questions, may I add, and it's quite a
Yeah.
privilege to talk to so many people in the industry for us because we don't really get that exposure down under. So please keep them coming.
Well, there's another one in the queue. Lynette asks, are you targeting a certain population with this product? So is your market pretty specific in terms of age or the kind of smoker they are? I know you just said you
Yep.
might not be for the major top user edge case, but yeah, anything that you think about when you think about your targets?
I think the product is designed for me and for Ryan, and so I think if I would say that it's not specifically designed to be only for a certain population. So my uncle he's like 60, he's 65, and like a builder and a car enthusiast, and he's like, limps around, and he's quite a gruff man, and he uses the product he's been using it to quit, And then we've got my friend who I was talking about on whose messages I read out to you guys. He is um, a small gay man who, you know, likes to go out and party, you know, on the weekend. And so we've got like it works for the product works for everybody who's willing to give it a go. But I think the demographic that it probably targets is sort of young or not young.
I would say dissatisfied nicotine users who are actively looking for a way out is
Yeah,
really, you know, people have had the thoughts. They know a lot of the people, vape fatigued people, you could say, or the group of people that are tired of the dependency, or, you know, one too many trips to the bathroom with their vape, you know, the reality of addiction. I think that is really our target audience. I think anywhere from someone who has been vaping for a few months and they decide, oh no, like, it's just two seasoned veterans who have been smoking packs of cigarettes a day for years, right? That's really who we want. And we're also going after a little bit of like the pouch seekers, you know, Zins, Valos, those are quite, they're rising in popularity in New Zealand. I know they're already quite the US. We're always 5 to 10 years behind you in terms of culture in general, but especially in the nicotine culture as well. We're also sort of targeting like the health people, right? Who or people who use nicotine and don't even plan to stop, at least minimize the harm. Don't step out for a sneaky cigarette. You don't have the odd. You do it safer, is what we're trying to say,
I reckon,
essentially.
Ryan, if you pop up the slides, that'll give a flavor of like what the branding looks like, and it'll kind of show what kind of audience we're initially.
Yeah, and as you do that, Denise just had a follow-up asking if you have any comments about your product versus the patch. So maybe as you show it, you can talk about some of the
Right.
other like we know the existing products that are out there, and maybe you could talk about like the limits of those and
Yeah. So um, our product is the oral spray is designed to be slower acting than cigarettes and vapes, but faster acting than the other um, products on the market. So that because I think what you don't want is, like Ryan said, you spray it and you go, okay, well it's not hitting straight away, and then you feel it a little bit later. It's about 30 seconds to a minute before you start before the initial nicotine starts to be absorbed into the bloodstream, and then there's sort of like a 5 to 10 minute half-life where the nicotine is increasing. You're absorbing it through the mouth, and it's entering the bloodstream. And then after that, the nicotine will last for, I think it lasts in the body for about half an hour to an hour, depending on your metabolism. Um, and um, compared to something like patches, which is like a slow all-day release kind of product, it's you're really not going to notice uh, and like have a noticeable effect from the patches. And I think that's what they're designed to do, right? I feel like patches are really good. You've already reduced your nicotine consumption right down, and now you just need some nicotine and to forget about it. But the patches are the slowest of all the nicotine cessation products. And then you've got the chewing gum, which is you have to chew it to then release the nicotine, and so that takes time. And then some of it will be swallowed and not sort of applied to the oral mucosa, and so you'll lose some of the effect there. And so it's slower, but not as slow as the patches. Um, and it's a sort of a slow release as well. So you'll get some nicotine, and then you'll get some more nicotine, and then you'll get some more nicotine. And whereas ours is kind of like you spray it on, all of the nicotine hits the oral mucosa. It takes a little bit longer. It takes much longer than vapes and cigarettes, but still only 30 seconds to a minute. And then you're absorbing most of that together. And then with the pouches, they're quite a high dose of nicotine, even at the lowest end, right? So they got 3 mg. What happens is they get wet, and then it dumps like 3 mg of nicotine into you all at once. And so it has a similar effect as vaping, where you get all of the nicotine really quickly all at once, because of how high the dose is. Whereas ours is a similar thing, but it happens quicker, but it's a lower dose. Yeah.
And Denise, maybe specifically to your question, I think somewhat comparable. I think we're just trying to mimic a little bit of the habitual, hand to mouth. Some of those behaviors are quite strongly associated with addiction as well, that people maybe don't realize, but oddly plays into what keeps them going. I think the patch is also a great tool for cessation as well. We, encourage anything that works. At the end of the day, ultimate goal is to get people to stop and minimize harm, and it could be a combination of those, but at least people have access to choice, maybe various tools that might work for them. So that's sort of our philosophy.
I mean, we even thought about making some patches that were like more fun than just those square things, like, how Nelly had the like, the plaster under his eye. Like, I'm not sure if you want nicotine like on your face, but like, that kind of stuff. Because like the whole point of what we're trying to do here is like it says on the slide here, like smoking is cool. Like it's cool to like have a cigarette. Like that's why it's in all the movies, right? But like quitting smoking or stopping is like it's not that cool. And so we want to try and like bring some coolness to like making the right choice, essentially.
Yeah, thank you for this. Well, we'd love to see a couple more slides, and then I think we just have about 7 or 8 minutes left. So, invitation to everyone who hasn't asked a question yet, or if you have follow-ups, please put them in the chat. But then also, I want to make sure we ask this question about how people can learn more or get involved, or if they want to help or collaborate. Definitely want to hear about that too. But let's start. Yeah, I see there's already a couple questions in the chat.
Neat, neat. So obviously you've understand our mission a little bit here, but here it is in a very short sentence. So we just want to be the world's most relevant cessation and harm reduction nicotine brand. That's our big thing. If this works really well and people copy it and people stop smoking around the world, we're stoked. That worked for us, and we want other people to have that. We've got a lot of this imagery, kill your bad habits. We're trying to have a bit of fun with that and make that. Here's some of the change we want to make. I know we've sort of babbled on a lot, so I won't get into it too deeply, but yeah, having control. It's a big thing. Control about what's going into your body exactly. With the vape, the difference between inhaling for a second and 1.1 seconds is quite a difference to that. No two people are going to have the same hit from something. It's not measured. We like data. We like being data driven. And then a little bit around the logic of why you do it this way, and to drop that stigma and some of the shame around addiction that we've found in our community, in our research, to the doctor, talking to the pharmacist, admitting you need help, and then having a very quick pathway to saying, oh. Then the freedom and dependency side, yeah, absolutely. I think we've talked and touched on that quite a lot as well. As Luke said, it's quite bad taking your vape to the toilet or waking up in the middle of the night and pulling it from under your pillow. But it's quite shocking how prolific that is. In fact, here's just a little bit around the mouth spray itself, some of the features, but I'll leave that up maybe while we answer this last question here as well.
Yeah, so what I like one of the themes I hear is just really lowering barriers to cessation, lowering like shame barrier or emotional barrier, or that barrier of having to make a primary care appointment or having to even ask someone to unlock something. Like all of those things keep people from like taking that initial step. And so, yeah, what I'm hearing is if you lower that initial step, then people become more curious about like their relationship with nicotine, like beyond just I'm a smoker or I'm a vapor.
Yeah.
I really, I'm really like moved by how you talk about like you just have to be more intentional, or you decided to be more intentional about your relationship with nicotine and really think about it bigger than just the vape, right? And what are you really getting from it? What do you need? And so like inviting people into more of that relationship rather than just like a are you quitting or not? So I think
Yeah.
yeah, I appreciate that. And we do have one more question.
Neat. And maybe I could just speak to a little bit about, I touched on earlier, there's a lot of people here that in various fields that touch on nicotine, especially cessation. And again, it's an honor for us to be able sitting here talking to you from little old New Zealand. And essentially, I guess we need help. We'd love to, if this resonates with you or you see future or an alliance there, please get in touch with us. We'll have our emails sent out or available. Even if you just want to get on a call and just poke holes, we love that. Would be very appreciative of that. But possibly any potential partners, collaborators in the audience, or if they can see a market fit, or there's potential grants available or cessation programs that you're involved in, would love to hear about it. Or if there's a bureaucratic wizard in the audience and like navigating FDA applications, we'd also be all ears. We could share with you the quote we got to get through that process, but it's a little intimidating to say the least.
I think it could actually buy you a house in West Los Angeles. So, you're gonna have to weigh
Oh
that.
yeah, you could buy the whole North Island in New Zealand, I'd say. With that. Yeah, yeah.
Um, Sue, any more questions from you, from your
I
crow's
don't think
nest
so. I
up at
think,
the top?
no, did we get to, oh, good, you put the,
I think Julie Martin asked if there's a prescription barrier. And no, we want this to be available over the counter everywhere that nicotine is sold. We don't want people to think about. We want to, yeah, like Meg said, we're lowering all of the barriers to entry here. We want to make it as easy as possible, so you don't have to be like, oh, that's more expensive than what I normally buy, or oh, I have to talk to somebody to get that. Yeah.
The cost is massive for us here, and especially the communities that are the most affected. Cost we've found in our research was the biggest barrier for them to attempt sort of cessation. And so that's a massive part for us, is to keep that cost quite low and accessible.
Mhm. And
Yeah,
is this different? I know there is a prescription spray right now on the market, but that are one of those, 6 companies that make cessation products out of the millions that make tobacco ones. What is the different, like what's sort of the key difference between that product on the market here now and what you're offering? Besides, obviously the packaging is different, the idea of no prescription
for
is
sure.
different. Is
Sure.
the
I'd say
formulation different?
yeah, absolutely. I'd say our biggest competitor, well, not competitor, right? I think we welcome them selling things as well, but Johnson and Johnson obviously owns Nicorette, large pharmaceutical company. It's quite expensive here in New Zealand for their product. And it's really the value proposition is not there for someone who smokes a vape, right? It's about 5 times the price of a disposable vape. Quite off-putting. It's also quite bulky, clunky, and medicinal looking. To be fair, as there's a lot
Yeah,
sleeker, fits into.
I think they're about $65 US,
Oh
something like
wow!
that. I mean, I'm
Wow,
sure
such a good
insurance
news.
might pay for a part of it or something, but yeah, I
Sure,
think that's
sure. And then it does come down to ingredients. If you flip that over and start reading, you might as well be speaking a different language for most people. We've really put effort into keeping ours plain and simple. It is water, nicotine, natural flavors or extracts from generally fruit. We're at first very cagey about bringing other flavors out, but the market just simply wouldn't agree without doing that. People weren't prepared, so we are doing a sort of a red Otago grape and a green apple flavor. Natural ingredients, that's our big thing as well. It's all natural. You know exactly what's in it. You could flip it over and just create your own really with that. Transparency is quite key for us.
Mm. And there is, we have got some IP around reducing the burn of oral nicotine. At the bottom there, we're still working on how to incorporate that effectively into the spray. So it's in the pipeline, but it's there's some complications around how to actually apply that to the spray. But it's there, and we're pretty excited if we to release the new formulation with a reduced burn.
In accessibility, and the kiwi flavor is definitely in the pipeline.
I love that.
I'm not sure if you're familiar with the Listerine strips
I'm
as
not
well, the
that.
breath freshening strips. That's sort of in the pipeline for us as well, as a sort of an avenue to pursue as well.
That's awesome.
Yeah, just trying
Yeah.
to make
Well, that's great.
accessibility. That's it.
I love how you are all like, you've created, like, I love the ninja. You've created this
Yeah,
product and that you're iterating, and yeah, it's awesome. That's very cool.
appreciate that.
Yeah.
Yeah,
Fun
thank
with
you
it.
very much.
Thank
We really
you. Yes.
appreciate everyone's great questions today, like wonderful, amazing, in-depth questions. Thank you all for your time. Again, please reach out to Luke or Ryan or
Mhm.
to Sue if you have an innovation idea and
Yes,
you
would love
would
to
like to
hear.
present about it or talk about it or be interviewed about it. We would love to hear from you too. So, and special thanks to Christina today for being our amazing tech host.
That's
Thank you
right.
so much.
That's right. Or you could go visit them in New Zealand.
Yes, of course.
Absolutely.
And
The door's always
Stacy,
open.
I just saw your
Oh,
comment,
wow,
Stacy.
Stacy, that's awesome. Yeah.
We have also Luke and I just one-on-one have talked about, the challenge of having a cessation product with nicotine on it that you give to kids.
Mhm.
So really it's so difficult. And yet, I think one of the things Luke's talked about is that some of the other vape cessation products out there that have no nicotine don't actually do the thing, like they don't actually wind you down. And so, yeah, I think there's more to be discussed and, yeah, prototyped, iterated on, but that seems, yeah,
Mhm.
I have a teenager in high school, so that's front and center of my mind too. Thank
Mhm.
you so much, everyone.
Yeah, thank
Thanks,
you.
guys.
And for those of you that are still with us, there's a QR code. You could join our mailing list. We offer a variety of different services and trainings and discussions like this. So we'd love to have you join again. So thank you. Thanks so much to Meg, Luke, and Ryan, and Christina. So thanks.
Thank you so much, everybody, for putting that together and coming back. And we look forward to hearing from some people, and we love chatting about it. So even we'd love to hear what you're doing with it as well. It's
Yes,
all
yeah.
inspiration to us. So much
Mhm.
appreciated.
Great.